like to go ahead and call this meeting to order of the Mangum City Hospital Authority. At this time, if we could have a roll call.
Van Zant,
Here.
Lively, High School,
Here.
Vincent,
Here.
Webb.
I believe that gives us a quorum. Moving on to the consent agenda. I make a motion to approve the consent agenda
1 through 4.
1 through 4.
I second.
Okay, if we could call for a vote.
Okay, just a second here. Okay. Van Zant,
Yes.
High School,
Yes.
Vincent,
Yes.
Okay, moving on to remarks or inquiries from the audience not pertaining to any item on the agenda. Okay. Looks like all those wish to remain quiet. Moving on to the agenda items, the reports number 5, the financial report.
Hey, good afternoon, everybody. This is Andrea Snyder. I'm the Cohesive Director of Finance for Mangum. So to start off, overall, July was a good solid month for the hospital. We had cash receipts of $892,000 with disbursements of $980,000. Our average daily census was just shy of 11, which is right in line with our target. Other positive contributing factors for the month were a net increase to the Medicare receivable, bringing that total to $895,000, and a $200,000 recognition of the hospital's COVID funding, bringing July's operating net income to a positive $196,000. And just to update everybody on the status of the $895,000 Medicare receivable, we are still waiting on the rebuttal letter from Novitas. We're required to receive the letter before submitting our request to have the funds paid out to the facility rather than being applied to any outstanding ERS loans. And with that, I'll open the floor for any questions.
I have a couple questions. I noticed on the claims that we have some for Medirite. Can you explain that, what that meant? Medirite Management Transportation Services?
Can I ask which file you're looking at, please?
It was while I was reading all your financials. I was looking at specific line items, and I just came across Medirite Management Transportation Services.
I can explain what it is. It's a non-emergent transport, so it usually transports patients from the referral source to the hospital and also from here to another healthcare facility.
Okay, so when it said management transportation,
What was the question?
never mind, I will table that till I bring the page next time.
I got it right here.
Okay, can you read that for me?
Sure, it
Thank
says Cohesive Medirite LLC, MGMT Transportation Services. So I think, the question just was,
What does that mean, management transportation, the MGTMT?
I think
wasn't
it
clear.
was just an abbreviation of the name. It is a cohesive transport company.
I get that. So it's patient transportation from point A to point B?
Yes, ma'am.
Like referrals, like the hospital refers out to, I don't know, provider B, we then transport and charge.
Yeah, it is like, for example, if a patient has an appointment in Altus, they'll take the patient there. More times than not, it's usually bringing the patient from a referral source into the hospital.
All right.
It's for multiple different uses of patient transport.
Okay, all right, thank you. Also, I did notice the following notation under Matt Moran, credit future month's rent in the amount of $3,400. I guess I'm questioning what that means if the rent was $850.
So the way the aging report generates is based on our, it's our system.
Yeah.
So when we recorded all of the future months, rent, when we reversed it off, the way we did it, it just generates a credit and it gets offset in the accrued AP. So
Okay,
it's not
gotcha.
specific to the line item on the aging report, unfortunately, but that's why it lists a credit.
I got you. I just hadn't noticed it before. So
It's not actually a credit, let
I
me
got
clarify.
you. I got you. I got you. I just never had seen it quite, that line item, let alone that note on it. Okay, thank you.
You're welcome.
Well, I would just like to notice that what a great job if, you know, we're in the black this month. So I'd just like to say thank you guys for all the hard work. That's pretty awesome.
I'd like to
What a
ma-
great month. So keep it up. Thank you guys. Go ahead.
About once a year, I bring up the same point. I think I brought it up last year in September, because that's about the last payment we made. There's a company that we retained, and it was a company that we, the board, retained originally to help us regarding all the legalese about all the prior management company, and we have not made a payment but once in September of last year. And I believe we had that same discussion a year ago about that, when we had entered into an agreement, that is something that we, the board, actually felt important enough to at least make regular payments as goodwill. And once a year, that's not necessarily goodwill. So I don't know if we need to bring it back up once a year, but that is one of the companies I had voted upon when we
What-
first got on the board.
What was the company?
The Dorner, Sanders, and other legally, it's the company that handled all of our previous management companies' lawsuits and such things. Again, I'm just bringing it up once a year since we made that agreement and we have not made any payment but September of last year. That's just not acceptable.
Yeah. Well, we'll definitely look into it and
As
sure.
again, once a year, we bring it up. It's
So-
getting a little frustrating.
Thank you.
Would it be possible, could we vote, Corey, tonight to say that we need to send them a monthly payment?
We did that last time, we didn't vote, but we discussed it in the meeting, and that's when a payment was made.
Can we make it a line item point that, like, after talking to financial says it's okay to pay them let's say $1,000 a month payment per month or something?
$1,000. We owe him $380,000.
Yeah, I mean, we owe them a lot of money.
We
but-
have it on the guesstimation every month between $6,000 and $9,000, and we never pay it.
Or does that need to be a topic put on the agenda for next month?
How do we follow up on things such as that?
That would probably have to be its own agenda item,
Okay.
since it's that particular vendor.
So, Dale, is it possible that you add that onto the agenda and talk to financial and see what their recommendation would be that we make a monthly payment?
Yes.
To at least start making some sort of goodwill gesture. I know I always feel better when I receive a check in the mail without sending a reminder,
It's been a year.
you know? Cool. Thank you. Moving on to number 6, the quality report.
I'm Denise, the quality manager here at Mango. I believe you guys have the report. I'll just kind of go over it with you. For the month of July, we had 11 acute admits, 6 swing, and 18 total discharges. Like Andrea said, just shy of 11 on the average daily census. We did have a high number of AMAs at 6. We had one readmit. No complaints, grievances. We did have one death. We had, again, no infections that were hospital acquired. And 9 ED transfers to higher level of care for the month. No in-house transfers. Any questions on anything on that report?
I do not. Does anybody else? Okay.
I'll
What's-
make a motion.
What's, I don't think we need a motion. We just move on to.
You don't approve
number-
reports, yeah.
Yep. If we can move on to the clinic report.
Jeff, you on?
Yes, I'm on. I just got here. I haven't seen the full agenda. Was there a
Oh, no, hey, Dennis.
question about the budget or?
Oh, no.
or we-
Hey, Dennis, we're on the clinic report. We were asking for Jeff.
Oh, sorry. Thought you were asking. Is it me? Is it me?
It's you, man.
It's all you,
You're
buddy.
on.
You?
I'm sorry. I thought they said the budget report. My apologies. Good evening, Mangum folks. Hope everybody's doing well. I won't keep you but a short second. July numbers at 158 visit, a little bit misleading in the fact that if you notice, we did around 75 to 80 sports physicals that you could actually count as a visit in there. We have been going out to the schools, the communities, El Dorado, Blair, the likes of those communities, and doing their sports physicals. It's that time of the year, and I think it shows. And here in a second, I'll even mention it a little bit more. I think that we have new staff in the front, and I think that these visits that we have made out in the community are reaping benefits. I don't want to put the cart before the horse, but I've been told that August has been very good to us in the means of visits. So I looked and saw, and there's some validity to that. So I think it's paying off is what I'm getting at. Our ECW continues to progress, and we should be up and going by, I think the soft go live is September the 12th. So I think we'll be doing well with that. Again, things are going well. I would like to follow up, if I could please, with something that one of the board members from last visit left with me. And she challenged me to reach out to the Dr. Gibson and her cardiology group and to maybe form that relationship a little bit better. And I did. I reached out to the Integris cardiology group, where I met up with the manager by the name of Shelley, and she was a wonderful lady and a nice conversation. She has agreed to send us the schedule for that month in advance so that we know who's coming in and going out. And she agreed to open up a lot more lines of communication with us. So I think it was a good meeting as well, but I just wanted to follow up with that if I could, please. Numbers are numbers, they're doing good. Again, I think August is going to be quite a bit better than July. Everything that by appearance is exciting and ready to go. Are there any questions I can answer?
When you said you're going live on September the 12th, are we talking a reopening, or are we talking live with database? How did you mean that?
Oh, no, so that will be a soft live, correct? So the EMR systems, eClinicalWorks, I often
Right.
refer to it as ECW, will be our new outpatient EMR system, and we should be up and going on that system by, September the 12th, I believe, ma'am.
All right. So it's just pertaining to the software usage. Thank you.
Yes, ma'am.
All
Yes,
right.
ma'am.
Thank you.
Thank you. Anything else I can answer for you?
What was the hourly stats we're trying to hit? 2.5 of patient load? What is it we're trying to?
The average patient per hour, ma'am?
Yeah,
Is
the
your
one that we're
question?
shooting for. What was it under Randy and what is it now? You know, that's our stats of daily, hourly encounters
We're shooting for 2.0.
for two
patients
patients.
per
Okay,
hour.
all right, thank you.
Yes, ma'am.
Hey, from that, reading that report, it really sounds like we're seeing huge leaps and bounds. So I just want to say, thank you.
Thank you for that, but I cannot accept the honor on that. That's a hardworking staff of Tiffany and Brittany and the nurses and the receptionists. They're doing a wonderful job getting their name out and not turning anyone away and,
Please
doing all
pass
the right
along-
things.
please
So
pass
I
along my
appreciate that,
sentiments.
but the glory goes to those hardworking, ladies in that office.
Well, thank you. You're really starting to, it looks like we're seeing some of those results pay off. So tell them thank you very much.
How do we handle the no-shows?
The no-shows, again, if I had to point to anything that is concerning to me, is the 17%. I still want it around the 10%, 8 to 10%. But there again, I'm waiting for the August numbers to come out. I think there's going to be some difference in that. I think that those time slots are being filled by all those people, which means those time slots, that people are not turning, my hope is people are not turning away from their visits as much. So, I expect to see a moderate decrease in the, no-show rate, for August, but, I'm waiting to see that.
And with the ECW, that new software, there is a function that we can do text reminders, so things like that, hopefully we can do.
Yeah.
Thanks.
Any other questions?
Thank y'all, and y'all have a wonderful evening.
You
Thank
do
you.
the same. Thank you. Moving on to the CCO report.
Good evening. We're proud to say that Mangum Regional Medical Center's Emergency Management and Administration coordinated with the Greer EMS, ARIVAC, Mangum Police and Fire, and the city manager to begin preparations for an active shooter drill in our community. We're also working together to get the active shooter drill going in our hospital as well, to make sure that we're prepared for that. There seems to be a focus on that lately, so rightfully so. You'll see there, it seems somewhat redundant to continue to show this, but I want to make sure that we understand that we continue to have sustained outstanding performance, as evidenced by 0 prevalence of hospital-acquired infections, catheter-associated urinary tract infections, and central line-associated bloodstream infections. That's pretty paramount in a hospital, what we're doing to have 0, and we continue to sustain that. Again, another focus lately has to do with medication administration, adverse reactions, and medication errors related to that. Out of 10,908 doses of medication administration, there were 0 adverse reactions. And on average, there were 0 medication errors per 1,000 doses administered at the hospital. Pretty proud of that. Our laboratory completed 2,108 tests with 0 repeated labs required. And then the new and improved dietary team, along with Cohesive Healthcare Management, provides delicious meals free of charge to on-duty staff. Patients and visitors continue to rave about the quality meals being provided. We're super proud of that team. There's a good culture and atmosphere in there. We're really proud of that. Any questions, comments, concerns?
Great job. Thank you.
all.
Moving on to the CEO report.
as you can tell, you've heard from several of the Magnum Regional leadership, a lot of good things going on, and they deserve a lot of credit for that. We continue to keep our staff and providers updated regarding new policies on different regulations and so forth. COVID concerns have actually had a little trouble with this report because as of today, they're trending down. At the end of July, they were trending upward, but we are seeing quite a downturn in the positive tests and so forth. Monkeypox is on everybody's mind, including.
Have we seen any cases?
Infection control nurse. I'm gonna have to defer that to Daniel. I don't think we have had any here.
Not at Mangum.
Okay, I've heard the first words of quarantine at school, so that's why I'm a little concerned, because quarantines are back in.
We're definitely have a vigilant eye towards it, but
Gotcha.
I didn't think we had. Daniel just confirmed that. Patient care continues to be outstanding. I'm having people catch me in United, at the hall, at the hospital, et cetera, bragging on the care that their relatives are getting. And you should be proud to be leading a group like our staff out there for sure. We have had an increase in our census somewhat. We've had 13 as of yesterday. I think maybe one went home, so I think we're down to 12 today, but we continue to be in that 12 to 14 range, which might remind those that might not know when Cohesive showed up on the scene, that average number was around 3, if I'm not mistaken. So we continue to see improvement from corporate and local efforts. It's kind of a commercial for the community, I suppose, particularly since we're live on YouTube. We're seeing on average 5 people per day in the ER, 30 days a month. If we continue to get the support that we're getting from the community and so forth, there's very little chance that would ever go away. But it's a very, very important institution out there to those people, 5 a day, that would have to be going somewhere else and seeking care, except they get to come see our great providers and Daniel and the rest of the clinical staff and give them really good care. Again, hear lots of bragging from a lot of people. I want to, before I ask for questions, Jeff was a little bit humble, I think, about his leadership there at the clinic. He definitely gives credit where credit's due, but I know in the last 30 days, they've had one day they saw 17 patients, even with the no-shows. They've had one day that they saw 18, one that they saw 19, and last Thursday they saw 25. So they're really doing some good things down there. We hope to see the numbers continue to climb. And with that, I'll just open it up for questions.
I came to the emergency room back in March, and after my visit, which was an amazing visit, I had a really good visit there. They took care of me really well, felt really good when I left. But after my visit, I guess a couple of weeks later, I got a survey in the mail, and I wrote my glowing report. Didn't sign my name to it, just wrote my glowing report and sent it in. Where does that go?
It goes to our medical records department, and then is, where does it go? Well, I don't know. Where does it go?
Should be part of our Press Ganey, as far as I understand.
Part of your what?
Our
Press Ganey surveys.
That's a service that we, a vendor, that we pay to manage those and report those to us.
I was gonna say, don't they go to a third-party vendor? I actually brought Jackson County's. Anytime you go to Jackson County for anything, within 48 hours, you have one of these. And it is a third-party vendor. Are we not using a third-party vendor?
Press Ganey's third
Yeah,
party.
Okay,
yeah.
just making
I
sure,
couldn't
because we
think of
had
the name of
voted
it.
on
I
that.
know it's been collected somewhere, but I couldn't think of it.
The reason why I asked that, I was just looking at the reviews online, and though the hospital has reviews out there, they're years old. We don't have any new reviews that are out there. And so I was just wondering how we marry those customers that are coming out there, getting that good service and getting them to say something nice to change the perception of the hospital for those who have a poor perception of it.
Absolutely. Yeah, and that's and we have that challenge everywhere especially when it comes to the Google reviews. Most people won't go on there and put a glowing Google review. It's only if they want to put the hospital on blast, or have a complaint. But I mean, that's a good point. So we're open for suggestions, because it's a problem everywhere.
Kind of in conjunction with yours, I had a loved one in the ER last week, and I would just like to say what an amazing quality of service. We were in the ER like less than an hour. The X-ray machine was brought directly into the room, and I mean, it was top notch. And you know, I've been in Jackson County ER with my own issues, and I would rather stay in Macomb.
Yeah, I think there's a disconnect, because sometimes I do hear not so great things, and it's not been my experience when I've gone to the clinic. It's not been my experience. It's not been my experience when I go to the emergency room, and I'm not out there all the time. It's really a one-off for me,
Yeah.
but I'm not hearing that back from the community. So when people ask me things, and they typically do because I'm in the chamber, and so they're just walking in and just start talking to me about whatever's going on. And I'm, giving my response and my defense or whatever it is, it's not translating to the community the improvements. They don't see it. And if you don't see it, you don't know what's going on, because perception is reality.
Absolutely.
I don't know if this is the right time or if this would fall under new business, but I brought that nonetheless. I always feel sad when we locally do things with a hospital or a facility that is not in our county. And not just do we have at school a scrubs club at the high school for potentially health, for students that want to go into the healthcare business or healthcare field. And then I happened to pick up one of these packets a couple of years back. It's to do a job shadowing. I thought that maybe we could implement a job shadowing that does not obligate us to anything other than maybe for a shift or two to come and shadow. I don't know if this is proprietary, but it was laying there to be grabbed. It's a couple of years old, if any of you would be interested. But that would be something maybe that we could tie in, again, our locals, as in maybe a student that might be thinking about going into the healthcare field. Of course, there's all the disclaimers, la-di-da, that you would have to have, etc. I'm tying it in with your comment about if we don't have our peeps go, and maybe, if we could do something of that sort in small here, we might not lose everybody going there. Just again, it's just a probability of, again, getting our name or our hospital a little bit more centered with the peeps around here.
Absolutely.
Just a thought.
Yeah, no, that's a great
Okay.
suggestion.
Anyways,
I'm taking notes on marketing, job shadowing.
right?
Just a little bit of history on
Yes, sir.
this Club Scrub.
Yes?
They were started by the Southwest Area Health Education Center that was based at
Yeah.
Cameron
Yes.
years ago. This is years ago because I was with the Area Health Education Center in
Yes.
Northwest Oklahoma at that time. So
Good.
those have been
Yes.
well established for a
Yes.
long time.
Yes.
And if you wanted to do
I just think
like
it's
a day in
always
the life of a
sad
healthcare
if we
professional
don't have
in
anything
Mangum.
local.
I've actually got files on how to do those things, because I used to do it. That was
Yes,
part of
yes.
mine. That was, recruit, train, and retain
Yes.
healthcare professionals
Yeah.
is in my background.
I just think it's important for our
Absolutely.
locals.
Yeah, growing your own is,
You know,
longitudinally, it takes
it's
a long
30
time,
minutes
but it's the
drive.
best thing to do.
Not everybody has a car, but they could get maybe, to our hospital for a shift or whatever, however many hours.
Absolutely.
Thank you for the consideration.
Yep, I'm looking at that. And to your point too, what we've done at some other facilities and communities, maybe we can start speaking during, if the Chamber of Commerce has like monthly luncheons or something, we can have Dale or some leaders kind of exposing that good word, and then just, I think, encouraging people word of mouth when they do have a good experience to
Come do the radio with me.
Yeah, yeah,
Keep
get on the
asking.
radio. But yeah,
Keep
we'll-
asking.
Is there a popular radio station around here?
The one I'm on.
They're all AMs. They're all AMs. You smile. They're AMs.
She has her own radio show.
Yeah, okay.
Not my own, I'm just. one
Yeah,
little
yeah,
key in the
whatever.
box.
Yeah. Okay, there are no further questions to the CEO report. If we could move on to item number 10, please. Discussion and possible action in regards to the Blue Cross Blue Shield Medicare Advantage HMO amendment. Wow, I can't say that. Amendment.
Okay, this is a payment agreement between Blue Cross that happens to be part of their HMO group. The bottom line on it, it increases what they will pay us on acute care daily reimbursements from $3,021 to $3,336, and on swing bed from $2,967 to $3,231. And I'm pretty sure that's effective 1/5.
Yeah, that's what it said.
I'd like to make a motion that we approve the amendment.
I'll second that motion.
If we could call for a vote, please.
Van Zant,
Yes.
High School,
Yes.
Vincent,
Yes.
Webb,
Yes.
Okay, moving on to the discussion and possible action to approve the Blue Cross Blue Shield Medicare Advantage PPO addendum.
This is basically the mirror image, it's just part of the PPO, numbers are the same exactly. They're increasing by the same amount for acute care and swing bed as the HMO. Just depends on, whether the patient is a member of Blue Cross's HMO or the PPO.
Got a question. On both of those contracts, it listed, I want to say on one 46%, on the other 48. Does that mean we're on the 46th or 48th percentile of how we're being paid? It was on the actual form itself.
Good
If you
question.
don't know, that's okay.
Lori, do you know the meaning of the percentage in the contract? She's,
On the first page.
first page, I think she was referencing the 48 and 46%.
Yeah, so those are actually extensions into Greer County in January of 2023 for the HMO and PPO product.
Yeah?
And they're gonna pay at our current Medicare rate for Mangum at the current Medicare rate letter.
So what was the percentile, the meaning of the 46% or the 48% as it is
So
written?
that was the previous, that was prior to January 5th of 2022, but in January 5th of 2022, Medicare sent us a new rate for Mangum, and so what Blue Cross and Blue Shield is basically saying that they're going to reimburse us in January of 2023 for Greer County at the most current and updated CMS rate letter.
So she was saying that 48%, they were paying us 48% of the Medicare rate previously, and now it's gonna be the full rate.
Right.
And what is the new rate?
Do you know the new rate off the top of your head, Lori?
I'm pulling it up.
I believe it's, I can't read that.
Yes,
So 47, it'll be 47%.
All right, thank you.
I'm sorry, 48%. They'll be paying us 48%, effective January 2023 for Greer County.
$48% of the allowable?
48% of billed charges,
Okay.
For the outpatient piece. The inpatient will be the $33.56, per diem.
Yeah.
And the swing would be the $32.31 per diem.
All right, thank you.
Yeah, no problem.
Any other question? Well, I'll make the motion.
I'll second the motion. We could call for a vote, please.
Van Zant,
Yes.
High School,
Yes.
Vincent,
Yes.
Webb,
Yes.
Okay, motion carries. Moving on to discussion and possible action to approve the payment for the emergency purchase of a 100-gallon commercial hot water heater.
I think you skipped life share.
Oh, I'm so sorry. Yep, I did. Discussion and action regarding the action to approve the Life Share Transplant Donor Services of Oklahoma Amendment.
Zaria.
We have an agreement with LifeShare, you know, in rare events someone passes away, we call them, they do an assessment, and you know, check to see if the person is a donor, if they qualify to donate. And this is a change for a CMS Rule 3.14, where LifeShare is required to assume and pay the donor evaluation, maintenance, and surgical recovery costs going forward. I don't know how much experience we've had with that. I'm not aware of any expenses that we've had up to this point. In any case, I don't know if Daniel or someone else on the call might have some more information.
Oh, we're in the service.
I'll make a motion.
I'll second.
Go ahead.
I'll second.
If we could call for a vote, please.
Van Zant,
Abstain.
High School,
Yes.
Vincent,
Yes.
Webb,
Yes.
Okay, motion carries. Moving on to the hot water heater.
gotta have it.
Yeah. On Thursday, the 11th of August, our main water heater stopped working.
Oops.
And another opportunity to brag on one of our departments. Mark Chapman, he was able to locate the exact model. The connections matched in Altus. Carson was notified since the $7,403 cost exceeded our administrative authority. Mark's staff picked it up, replaced the 750-pound unit, saving installation costs and additional downtime. So they were right on top of it, got it hooked back up, had hot water flowing back. You know, 'cause it basically is the hot water heater for the hospital.
We're fortunate they had one in stock.
Absolutely. Absolutely. Exact same model, set it in there, connections hooked up, lit it, and we had hot water in a fairly short period of time. So I can't say enough good things about Mark and his plant op staff, their willingness to, you know, put out that kind of effort.
I'll make a motion. We approve the emergency water heater.
A second.
If we could call for a vote, please.
Who did second?
I did.
Okay. Van Zant,
Yes.
High School,
Yes.
Vincent,
Yes.
Webb,
Yes.
Okay, motion carries. Moving on to number 14, discussion and possible action to approve the renewal of Port 53 Technologies, Maraca license support agreement.
Okay. Y'all can probably tell I'm a real high-tech guy, but I'll make my best shot at it. Our previous provider of these multiple licenses was a company called Insight. And we basically were buying the same thing through Port 53 that we were buying from Insight. Port 53 has been willing to combine the three licenses and give us a 35% discount if we commit to doing business with them for 3 years. Insight was only willing to quote the Meraki licenses for 1 year. It's my understanding, been talking to our corporate IT head, Chad Lamson. Unfortunately, they're in the middle of a big project, so he couldn't be on here to do this presentation justice. But this is the system, the software that allows us to access the internet through a network. And without it, you wouldn't be able to, your phones wouldn't work, your EHR wouldn't work, and that includes at the clinic, at the hospital, and so forth. So it's a relatively small expense for 3 years' worth of access to the internet to allow all of our software and hardware to continue to function with the internet.
So the licenses that are specified, one was for 16, one for 4, one for 3, one for 2, one for 1, one for 1. They're different licenses, pertaining to the software or the hardware to get to the internet? Because the 16, I would think, would be 16 users as in the end product, but then the 43211 more servers? Security?
I know it affects our phones and our computers, servers. Past that, I can't give any specific information. It's very IT, tech related.
Yeah, I understand
Our
that.
corporate tech people were the ones that did the negotiation and were able to find 153 to give us a discount and lock our prices in for 3 years. Just basically costing us a third of that 10,201 annually. But we'll pay it up front and pay it up for 3 years.
So the $10,201.74, is that a year or is that the 3 years?
That's for 3.
Okay.
The numbers aren't driving though.
Mhm.
Those numbers don't add up.
We get the 3 invoice, so.
It's off several hundred.
Are you looking at the quote, the invoice?
Yeah, so if I'm totaling at the subtotal,
Mhm.
it's like 9,600. And I'm
Plus
assuming
tax?
it's, well, I don't see where the tax rate's on.
We can look into it to see if that's, that final number, that 10,000 is with tax included, if you'd like.
Here, I'll do this. real
It's
quick.
not. We clarified that we are tax exempt with this.
Okay.
There's no tax included.
One thing that everybody needs to be aware of, our current license expires on August 30th.
Have we
And,
submitted?
If they expire, we're shut down.
Well, have we resubmitted our license?
I made a calculation error. It is right.
I just have a quick question.
What subject did you used to teach at school?
That's why I actually did it 3 times, to make sure.
For the licenses, under quantity, the first one, 16, is that saying that you only have 16 users that can use that?
16
And then use that specific license, and then the next license will be only 4 users? And how many total users do you have at the hospital, and does this suffice?
I would say it definitely suffices, because I wouldn't put it past our IT to sign us up for something that is a lesser product than what we had before. And yes, that 16 is it looks like there are different types of licenses. And
Correct.
I'm even.
So it's specific, so if I needed one of the 16 and he needed one of the 4, we wouldn't cross over or anything like that?
Correct, yeah.
Correct.
It'd be designated.
Gotcha.
Yeah, that MR Enterprise, MS-120, 24P, MS-120, 48LP.
Well, one is
all
like
ties to
security
something
for the server.
that they know
so.
that we need. And I don't know how many people don't have to trust somebody that's an IT person, because they're the only ones that know the answers to these questions.
And just out of curiosity, what was the yearly rate we were paying?
They were under 3 different licenses, and we have not been able to track it all down. Part of it was part of the COVID purchases that we made. I suspect that part of this is tied into, some of the COVID equipment that we purchased, and they provided a 1-year license with that. And that's, running its course, and so it's all being combined into this one license.
I'd make a motion to approve.
I'd like to second that motion. We could call for a vote, please.
Van Zant,
Yes.
High School,
Yes.
Vincent,
Yes.
Webb,
Yes.
Okay, motion carries. Moving on to item number 16, discussion and possible act.
15.
Number 15, discussion and possible action to approve Systemex America Incorporated agreement.
Sysmex provides hematology reagents, consumables, and other related services. About 5 years ago, the hospital bought a hematology analyzer, and it's still working. But we don't have any expense in it itself, but whenever we do a test, we've got to have these consumables, these reagents and so forth, in order to, I mean, it might be a glass tube, it might be, some kind of compound that you mix in the blood or the urine or whatever. But basically, if you notice on the hematology, bring it up here right quick. We're part of a purchasing group that includes Sysmex inside of it, called Premier, and we're going from tier 3 pricing to tier 8 pricing. We spent last year around $6,000.
$187.23 savings compared to last year's contract.
Yeah, that's
$1 counts.
that's another way to say it. We are getting locked in prices through 2025 from this agreement, so. Recommend that you approve.
I'd like to make a motion that we approve it.
A second.
We could call for a vote, please.
Van Zant,
Yes.
High School,
Yes.
Vincent,
Yes.
Webb,
Yes.
Okay, motion carries. Moving on to discussion and possible action to develop related party relationship and monitoring activities reporting as recommended by the auditor from December 31st, 2017.
I'd like to quote something. This was.
Wait, did we skip 16?
We just
This
approved it.
is 16.
Or 16.
This is 16.
This is
What was 15?
System
Blood
X.
analyzer.
Did we skip something?
Nope.
Okay, I might have misheard it wrong, okay. Go ahead.
I probably said it wrong.
Okay. Okay,
Not yet, yeah.
all right, just to be clear.
I'm just trying to keep you on your toes. Sorry.
So are we good?
Yeah.
16. I'd like to quote from the audit, December 31st, 2017, and it was under enhancement of board oversight as listed as a material weakness.
And what page are you on?
It is on the page 16 or 96, depending upon, there's nothing in our packet.
No, I printed it.
Good. It reads, the auditor's recommendation, the medical center should work to develop and approve policies surrounding contract execution and related party relationships to monitor activities. And by having gone through to all about 4 different federal guidelines that have to say about CMS and everything else regarding hospital policies and procedures, duties of the board, this is one of the areas that we have not yet done. I did a smidgen of research on it, and it literally just says that the disclosure of related party information is considered useful, and that disclosure of the nature of any control relationships where the companies and other entities may or may not have under common ownership or management control, that it is important for a board to know who may own what part of any kind of other companies that we may or may not have dealings with. They're considered third-party services and third-party vendors. As I understand it, it's like a family tree sort of to be disclosed for any and all existing contracts all new contracts and what have you. What that means is, if, for instance, Cohesive owns part of Company B, or if any of the principals own part of this, it will have to be disclosed. That is one of the things that wasn't done in the previous management companies, and that is one of the things that mattered greatly.
Do you mind if I
So
just see
therefore,
that real quick?
I'm bringing that motion that we should have exactly that, not just for any future contracts, but also to hold, I would think, is the word moratorium the proper usage in that part, so that any and all current, future, et cetera, contracts that we are aware, if there is any such thing. And if I read that disclosure of the family tree sort of shows any third party or third party service providers that disclosure is needed for any of us to make informed decisions.
Can I
Any
see that?
input?
No, just that piece of paper you just read from.
That's just my notes.
No, okay. So, I'm a little confused.
We have a legal mind that could answer about related party trees and the necessity of having that for any of our contracts.
Just to clarify, what was your motion, or what were you proposing?
I have not done a motion. I was
Okay.
explaining why this was on our agenda, what that meant, why it was on our agenda, and I'm holding it to the audit that we had the last time for our board, and it was listed under the so-called material weaknesses that had not been instituted with the previous management company, nor do we have it instituted under the current management
My
company.
apologies, I thought I heard that you were making a motion.
No, I have not yet made a motion. I ask a specific question to you, good sir.
Well, we have adopted a policy.
Do we have that
If-
particular one?
If you go to page 17 of that same auditor report you read, that's the management's response, which means after they identified the material weakness, we told the auditor what we
Right.
did to avoid that.
Right.
And so in December 2018, the Board of Trustees entered into a new management contract agreement with Cohesive Healthcare Management and Consulting. Cohesive is not authorized to sign any contracts on the behalf of the medical center. All contracts go to the board for approval and are then
Right.
signed by the board chair. The board is also presented financial statements and policies and procedures for the medical center for their approval. So that's what we adopted to rectify a material weakness finding 2017-001.
But we did not make a motion, nor do we have in place any place other than what you just read on the page 17. Do we have currently a so-called third-party disclosure active going on for our management company currently?
Yes.
Okay. And do they fill out a particular form for that so-called third-party disclosure for third-party vendors as well as third-party service providers?
They bring that agreement, no, they do not.
So we do not.
There's not a form that they fill out.
Okay. Should we have a form?
That's typically not the practice.
So do we have any vendors or providers or services currently where anybody may or may not hold interests other than within the Cohesive company?
Well, that's why they bring the agreements to y'all and make that disclosure
Again,
here.
I'm asking specifically for this so-called third-party disclosure form.
Yes, they have to.
Family tree kind of a thing.
There's not a form.
There's not a form, okay?
There's not a form. They bring what they do is they present the agreements to the board and make the disclosure. That's what y'all adopted following the 2017 audit.
So again, there is no such thing as, when you say an agreement, that would just be a contract, any contract. Or is it
Define
disclosed?
contract.
Anything that is legal where two people sign. Is there a disclosure sentence? Is there a point? Is there anything on any kind of contract or agreement where any party does have to say yay or nay if a service is being brought to us that so-and-so may have, the child, the uncle, the wife, the this, the that, may be a provider? Do we have that in place? Yes or no?
I don't understand your question.
Can I clarify, just make sure
Certainly.
I understand? So what you're asking, or at least what I'm understanding, is when a contract has been formed, is there some kind of safeguard in place that we know that there's not some type of relationship
That it's
between
not
that vendor?
Ty's daughter owning
But I
that
think that then
service.
becomes our obligation when we're approving it on the agenda.
But if we don't know that,
But
how
I
can
think we should
approve
ask
it?
that. I mean, if that's something,
Yes.
then I'm thinking, when it's brought to us, then we can, I
Why
think,
not
in the
make it a
meeting.
standard part of the package?
That's what I understand.
Yes, that is
Okay.
exactly what I'm asking.
So you want to, okay, I just want to be very clear, because, we had that audit, that was the material weakness, that is how we fix that material weakness, that's what that paragraph on paragraph 17 of the audit report is, that is how we fixed it. So you're saying, what you want to do, if I'm understanding, is you actually want to change this to actually require a written document of them signing an affidavit saying there's no party relatedness. Is that what you're asking? Is that what you want to do?
Is that the standard in business when you come to a so-called third-party disclosure? What is the standard that is your field? Is that a sentence? Is it a form? What would that look like in general? Would that be a form, or would that just be a sentence, no
If there's like a,
relations?
well, see, you said the word third party, and you're not talking about
Well,
third
third
party.
party, as in company B. Hospital is bringing us to sign up with company B. Company B may be.
So you're talking about related parties, not
Yes.
third parties?
Yes,
Because
related parties.
a lot of, yeah, because I
Let me
was going to
change
say,
the word to related.
because you can have third-party agreements. There's
Right.
no, you can have a
Let's do the
third-party beneficiary.
Yes,
So third parties are fine. You're wanting a
Related party.
related party disclosure.
yes.
Either as a separate form or as a clause in the contract.
Whatever you deem would be proper. And we can table this till next meeting. If you'd like to research, I'm game with that.
Well, again, I just need to make sure. Because it's not me. This is you. So that's what I'm trying to find out, is what do you want?
Well, I would like something that alleviates the board from having been questioned. Did you know so-and-so is so-and-so's wife? Did you know so-and-so is with so-and-so and so-and-so? Those are the things we don't know. Those are the things that one gets hit up in the community. So again, a related party disclosure would simply mean that whoever we get brought the contracts, whatever services is, whatever, that there is no whatever, and if there is, then somebody should say that is so-and-so's husband or so-and-so's whatever, or is this a company that we may own or have something from?
Is there a specific instance in which this has occurred?
I'm quoting the audit, and I'm quoting research, yes. It's irrelevant if I bring something up from 3 or 4 years ago. So I'm just going by what I have read and what seems to be something that might be needed.
So are we needing to say, like, if I own are we talking about cohesives
Yeah.
involvement in ownership, or are we talking about Stacy Van Zant, my wife, owns a linen company and Cohesive is now using that, or are we talking about like?
It's us as the board, as trustees of a public entity, we have duties and responsibilities. And the duties and responsibilities that we have are not just within the audit, but it is within all the documentation that we've been getting all around between CMS and everything else. And again, I am a literalist, and yes, I take words literal, specifically when it is in these kind of documentations. So again, I'm game with tabling it or what have you, but it seemed important enough to bring that back up onto our board.
So what would your solution be?
To have that, to have again, I am neither a lawyer, nor am I the attorney for the city, nor am I the legal mind for our board, but it does appear that if it was important enough to be mentioned and to be written about and to be specified under duties and responsibilities of public entities and boards, that maybe we ought to have that as well.
So I wouldn't disagree with that, but I guess, number one, I don't know the circumstances behind that recommendation. And I do think that that may be important to understand.
Who had fingers in what company, and they made a schematic yay big that would fit on this wall. Company A, one had the hands in this and what have you. That's why all this mattered back in the day under other company. And yes, it would help to know some of the litigations that we're involved in.
And I know you're not the attorney and stuff, but what would make you feel at ease?
To be compliable, whether it is a sentence, whether it is a little something
you
that
keep saying-
says, we do not own any part of this service. Again, I am neither an attorney nor, but it does seem
So
that it matters.
So do you think we should make a motion on the next meeting to say basically, if
Standards,
Cohesive,
yeah.
if Cohesive owns any part of a company
Yes.
that they are
Yes.
representing an agreement
Yes.
with, that must be disclosed?
Yes.
And then also add in there that if any board member
Yes.
has an
Like you
ownership in the
excused
county.
yourself with the live thing earlier. I don't know why, but yes.
Oh,
Yes,
yes.
yes.
Yeah.
Yes,
I won't
yes.
go into that, but.
Exactly, yes.
So is it
Short,
just-
sweet, to the point.
Is it just those two parties, or is it anyone related to the hospital? Because I'm trying to figure out from an operational standpoint. how
I
you start
understand,
connecting all
I
these
understand.
dots.
Yeah, like,
It
I
is
mean, 'cause
about.
Because you're in a small
um,
town, there's the dots are gonna connect.
Yeah, like Kevin Adams is a friend of mine who owns a.
Well, I could care less about your friend. I do care about the legalese
Well, no,
when it comes to federal funding.
But I
and
understand
what
what
have
he's
you, to be
saying
compliant.
is it just the two, is your thoughts on compliance just
When we
revolve around?
get something brought to us, to sign us up, to purchase, to re-up, to any of that, to just have that little sentence marked,
Yeah.
no principals of the companies own anything.
I
of
understand that completely, but I think to his point, are you just suggesting that what would put us in compliance is that the two entities would be that of Cohesive and not necessarily its employees or the employees of the hospital and
I
the
believe
board?
that's it, yes.
Okay, that's what I was trying to
Yes.
understand. So it's just Cohesive itself and the board?
Yes, 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 because that is who we have the fiduciary thingies with, is the management
And-
company.
and are
who
we-
in turn, principals may or may not, again,
But are we?
just to be clear and clean.
And so I'm understanding, so are we certain that that's what brought this? Is
That
it just
is-
strictly that and there wasn't entities within the hospital?
No, it was companies.
Okay.
So
Yeah.
it was like third-party
Yes,
vendors, and
yes,
the
yes.
management company secretly had a stake in the companies.
Yes.
And they're only bringing us companies that they own parts of.
Yes.
Okay.
Yes, yes.
Okay.
I think I
Yes.
understand it better now.
Yes.
So
So
In
what
my-
would we do? Would we have like a form for every single one, or are we gonna just pass a rule that says, hey, if you have an interest in the company, please disclose it?
No, they have to disclose, not please. If we make a motion, it means it will be
They
done.
would have to disclose it, and then
Yes.
any board member needs to disclose.
If
or
you have a
abstain.
service that you're being brought to, that you have
Okay,
hands in, yes,
perfect.
yes.
Okay.
And I
Yes.
don't even, I just think that would be a motion and not necessarily something they would have to provide unless there was they would provide it when they told us. Or they would be required to bring it up, and we would be
Every
required
year,
as.
yes, whatever
yeah.
the contracts, yes.
Well, that's what we adopted then. It was,
Let's
That's- we'll have
specify
to
and
go
do it
there.
again.
So that's already in place.
yeah, that's how we satisfied the auditor then, was we would approve all the contracts, and so those disclosures would come through us.
But if we don't know those disclosures, how can we disclose? If we, the board members, do not know, how would we know? And how could we disclose when we don't know?
So the
It's all
disclosures
hypothetical.
haven't been brought. So
Yes.
when they sign a contract,
Yes.
and if there is a relationship.
It has to be
We've never been
disclosed.
told because we
Correct.
haven't received a disclosure.
Correct. That's it. All it is just one more step that one goes, we're good. That's it, no more, no less.
But could we then assume that if they'd made no disclosure, there were no connections?
I would hope so, but again, legally speaking, I would want to make sure that
But
we
does
have
that not provide for that?
That's correct. That's kind of what the system we operate on now is. Is it that, I mean, I'm trying to find it, but I drafted a memo on this exact topic several times. So that's, I can't find it off right now.
Would you like to table it till next month?
Well, again, I don't know what y'all want to do is what I'm saying. Because right now, they, I mean, anybody that has a related interest with a public body has to disclose relationships. I mean, that's mandated by state law. And so those, there's mandatory disclosures. So that's what I'm trying to figure out, what do you want for them to disclose that there's not a,
Well, I don't think.
Relationship.
If there's not, they don't.
yeah, but it sounds like that's what we're that's what we're talking about, is we're trying to discuss whether we want them to basically tell us that there's no
Correct.
like an affidavit saying we affirm that we don't have any related parties under this agreement. Is that kind of where we're at?
Yeah,
Okay.
that's exactly where we're at, because it is a mandatory disclosure. That is the word. I just want it in writing for
That
each
there's-
one of those.
That there's not a
That
related
there's
party.
not, yes.
Like a form they submit to us,
That goes with the contracts.
so just a standard sentence in a
Yes,
contract. that says
yes,
there's
just
no-
a standard like on your one form. No, nothing, yes, that's it.
You don't want to get yourself in a situation where you're precluding the signing of a contract because there is a familial relationship. Because what if, and here's an
But-
example, you decide to hire a mowing service to mow the lawn at the hospital. Well, Billy Bob's wife is a nurse in the hospital. There's your familiar relationship. If that's not disclosed, then you can't have them mow your lawn. Well, Mangum, like
Yeah.
all these other little towns, there's not enough Billy Bobs around to mow the lawn. So if you preclude not being able to sign a contract because of a familiar relationship, you're just talking about disclosure. You're not talking about precluding
Yes.
signing those contracts. You just have to say, here's the disclosure.
Of the related parties, yes.
You're hiring a company that I have a 10% stake in. There's
You would
the
have to
contract. And you
disclose
just
10%,
disclose that, but
and
it
you
doesn't
would then
preclude
be-
you from accepting that contract.
And you couldn't vote. I mean, if you were a voter,
I thought we were
right?
just talking about cohesive.
That's it.
Like, I
That's
mean,
what I
it-
was
it's
You
discussing
would have
too.
to-
Like, how
it
far
would
do you
have
go
to
with
do
this?
anything that you have a contract with that you approve a contract for, you would have to have a disclosure that, is there a familiar relationship with some entity in the hospital?
Jamal, you guys have a lot of expertise with other hospitals. Do other hospitals have anything like this?
No, it's brand new.
Okay.
Brand new, cool.
Typically, you just have to disclose if there's a relationship. You don't have to disclose that there's not a relationship. That's the public trust statutes in Title 11.
Okay.
But we're talking about like the CNA at the hospital.
No, I wasn't talking about the CNA at the hospital.
No,
I was
no, no,
talking
no,
about
no, I'm not talking about that. I'm talking about like how far does it run down?
But it is, the thing is the law is already applied to, like, for example, Mark Chapman used to provide certain services at the hospital. And
Yeah.
that's what prompted me to write the memo.
Oh,
Back in
okay.
the day.
Because he was an employee of,
Yes.
of a public entity.
Yes.
Or when Jeff Good was the fire chief, it prompted me to draft a memo based on that stuff. So this stuff comes up, and every time I draft these memos, I think you were on the city council, it's not you just have to report that there's a relationship so that we can apply the proper analysis. We've never made anybody disclose that there's not a relationship. Because that relationship goes more than just a corporate entity. It goes to everybody sitting at this table, it goes to Billy, it goes to Cohesive, it goes to employees out there. There's a related party disclosure requirement.
Yeah. So by that theory, that would mean that nobody owns anything on any of the companies that we've done since nobody has disclosed.
Well, the one, unless the ones that they did disclose, because they did make a disclosure on some of them.
Which ones?
Cohesive MetaRide was one, Cohesive Staffing Solutions was another one.
Yeah.
When they do say, hey, this is our company, they've made that disclosure.
Do we have a list?
No. But they've been attached to when they have had like,
I want the list.
Of all the related,
Mhm.
okay. That would probably be something Billy could help you with.
Maybe. Tag, you're right.
Well, I mean, it'd be part of the public record.
so are we tabling this, making a motion, or saying no action?
And I would just say, in my opinion, with what he just said, I think the responsibility lies on the person submitting the contract of making that disclosure.
But yet we're being held liable at the end of the day
Right.
if if they did not disclose. We as the board would then, is that not so? Because we should have.
Not according to Corey saying that basically
You're charged
they
with-
have to have the expectation to disclose in that contract.
I mean, you're charged with the to act on the information you know, not the information you don't know.
I mean, we can't be held responsible for something that we enter a contract in good faith by being provided information and come to find out they're 90% owners in a company.
Ding, 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 ding.
But that's what I'm saying, that becomes their responsibility to make sure that they inform us and we make decisions based on the information they have.
And that was what we submitted to them as, hey, this is how we're gonna fix the
Yeah.
problem in the audit, is by
That
doing
works.
this. And they said, okay. Correct?
Yeah.
Okay.
I mean, I think
Because
we're following statute.
Because the situation that was referred to in that audit was definitely not what y'all encountered on the board.
So it is your opinion that we do not need to do anything other than what is written, which is that companies may disclose?
My legal opinion is you're following the statute as well. If you want to make it different, that's fine, but you just need to provide guidance on what you want, I guess. Because that's what it comes down to, is when we had the audit, said this is your material weakness, we adopted this to fix that. So if we want to change that, we can, but we just need to be clear on what you're wanting to change it to.
No, I think I've stated what I was thinking and doing.
Okay.
And what have you, but apparently, as you just stated, there's no need to worry about it since it's already quote-unquote a mandatory disclosure. I guess I don't need to worry about that since that's already mandatory and,
Well, I'm not, my advice isn't telling you what you should or should not worry about. I'm just telling you what the legal standards are.
Okay.
And as a board, you just have to meet the legal standards. If you want to make something more stringent than legal standards, that's fine. But my job is, as your counsel, is to provide you, this is what the legal standards are.
okay.
So if you want to make it more stringent, you're free to do that. It's just I need to make sure when we adopt this policy, when I draft this policy, it meets your expectations.
Expectation would just simply be to disclose if there is, and that's it.
So since it's already.
Disclose if there is,
Yes,
not if there isn't.
yes,
Which one?
ultimately. Well, again, for me, for my safety, I would just add one little thing onto any of the contracts or any of the forms for the renewals.
Are
You
you
know, no
guys already
ownership.
disclosing? You're already disclosing?
Yeah, like Corey says, we put out there what companies we own. I mean, heck, our name's in it.
So then we're following the guidelines and everything should be copacetic. We're good to go. I guess I'm at a loss because we're spending a lot of time on this and it just seems like we're going in circles. If it's already there, we're already doing it, it's on them to disclose it, they're doing that, then we're good.
Good.
Am I right? Okay.
That's my opinion as well.
Okay, so
No motions, no action.
no action. Okay, moving on to, item number 17. The budget.
We didn't put it on the agenda. What was the question?
The budget?
The question, I guess, is where are we on the budget? I had the memory that we approved the budget, but I couldn't find in the notes to where we actually did approve the budget. Do you remember?
Never approved
I
it.
don't remember.
It would have been in March or April, but I couldn't find it in the notes at all. I know we reviewed it, and I don't know if we
We
did it on
didn't
this.
get it.
No, we got the budget. We got a budget. I just don't know if we decided to table it or what. But I have the budget that we had.
I do remember them saying that they were working on it and that they were going to be doing department level,
Yes.
Yeah,
but
There was a basic, but not,
other than that, I
There was a
can't tell you.
basic one, but.
but not department level or, that we didn't approve
that was my memory as well, that they presented a,
something.
you know, a general budget, and then they was gonna provide us a more detailed budget later.
This is Dennis, can you hear me okay?
Yes.
Okay, my internet's going in and out, and it just flew back in, so I don't have everything in front of me, but I'm going back through, my notes, and Andrea, completed a departmental budget, we do a budget at the departmental level, and that was completed on March 18th. When we were doing our strategic meeting, and this is just me telling you what I recall, we were going, my understanding was there was some confusion on whether or not, you could approve a budget, it had to be, a zero-based budget, and we only do accrual-based budgets. So I thought there was a conversation going back and forth about whether or not we were still wanting to present that. So I went ahead, and my understanding was to go ahead and email Carson the budget that we had created at the departmental level. And it was sent
sorry.
on May 2nd, and I believe Dale was a recipient, and I think I copied that, I can't, I've got it down here in front of me, I believe I copied Andrea Snyder and
Jamal as well. Again, that was sent on May 2nd, as well as notes, and this was as a follow-up to our strategic meeting, but it was completed. And this is, what we sent was a snapshot, which is the high level, but it is completed at the departmental level, and Andrea did a lot of work. Dale and her together, and I don't know who else involved at the facility level, but, and she may have some comments to add on that, but we would be happy, I'd be more than happy to even be on site and go through it with everyone. The other thing we can do as well is, if you want, we can actually do a projection in addition to that to update it on where we are today compared to our run rate.
Sounds great. Let's make that on the
But
budget
that
for
was
next meeting.
completed on March 18th.
Let's put that on next month's agenda.
Yeah, I'm sorry. That's my fault, guys, for not making sure that made it onto the next month's meeting. So I take full responsibility for that. That's on me. My apologies. Okay. So moving on to going into executive, I'd like to make a motion that we move into executive session.
And just so, so we can plan, I want to get you whatever it is you need, but my understanding was too that even last year, what I was told was that, by Cassie, was that they couldn't approve a loss. It had to net to zero. And so but we only do an accrual basis budget because that's GAAP. Just like we report accrual-based financial statements, and that's what we would continue to compare month to month. But what we would do, if you still need it to net to zero, is I can just assume, since Cohesive's the last to get paid, that piece of the management fee didn't get paid to net to zero. So if you had a $100,000 loss, or that's what we had for the month, then $100,000 of the management fee wouldn't be paid that month. If that's the type of budget you need to net to zero.
Are we required to approve a budget each year?
Mm-hmm.
And we just haven't this year?
Yeah.
And does it have to be, because I know what a city budget has to look like. Is it similar to?
No, since they're critical access hospital, they kind of got their own weird budget rules, so they don't follow the 90% rule.
But everything else they follow other than the 90% rule?
Basically, yeah.
So it would have to be a zero?
Well, technically, no, because it's a hospital.
Okay.
Yeah.
So it doesn't have to follow even that rule?
There's some caveats.
Okay. So I do think that probably needs to be added. If it hasn't been approved, I mean, we'll get busted for that at some point.
Mm-hmm. There'll be a finding on our audit.
Okay.
Is it the same terms?
Mhm.
Like we should have approved
Yeah.
it by,
Yeah.
before June 1st?
Well, actually, our fiscal year ends December 31st, so we should
Oh, that's-
approve it by November, the 30 days prior to the previous year.
We're way behind.
Yeah.
So we'll add that to the agenda next time.
Yeah.
Okay. I'd like to make a motion that we go into executive session to hear about item number 18.
A second.
Call for a vote, please.
Van Zant,
Yes.
high school,
Yes.
Vincent,
Yes.
Webb.
Yes.
Let's not do it like that.
Well, just,
Okay. Motion by Van Zant. And who did the second?
Oh, me.
You did. Okay. Okay, you want Van Zant,
yes.
Vincent,
Yes.
Webb,
Yes.
and high school.
Yes.
Almost forgot you.
Okay. Moving on to staff and board remarks. Is there any remarks by anybody before we close out the meeting? I'd just like to say, after reading the auditor's report and seeing some of the problems that I wasn't aware of, and then seeing how everything you guys are automatically doing is very impressive to me. Reading the auditor's report painted a very bleak picture of what we had been doing in the past, and I would just like to say thank you for such an amazing job that you guys are doing with all the reports that you're giving us and all the contracts and everything in very easable form. So I just want to say thank you. Did not serve prior to you guys, but after reading this, it made me appreciate you a little more. So thank you. I'd like to make a motion that we adjourn this meeting.
A second.
Call for a vote, please. Do we need a vote to go
Van
out?
Zant,
Yes.
High School,
Yes.
Vincent,
Yes.
Webb,
Yes.